Hello, hi. I'm sure you all can hear me. Hello, my Instagram followers, WhatsApp, YouTubers. I'm back again with another short video on a product we have called Calmazine. It's a Vita Nature product, but also marketed by Kedi. So, Calmazine has got three constituents: calcium, magnesium, and zinc. I have been putting up the caption that it was going to come in, the lecture was going to be coming up. So, out of the calcium, magnesium, zinc, I'll be taking on calcium right now. So, we'll be looking at calcium, its essence, its use in our body. Why calcium? Why do we eat food that contain calcium? Why do we have to be on additional supplements that are, that have calcium contained in it, right? And furthermore, would understand that calcium is basically an essential mineral we need to have in our food as a supplement as we get older, especially we women when we get menopause. So quickly, we'll be running down calcium. We ought to know now that calcium is a very essential mineral. It's basically is involved in the rebuilding and the breakdown of the bones. It actually makes 99% of the bones and the teeth. So you need calcium at every stage of growth. While you grow from different stages, from 0 to 6 months, 7 to 12 months, the different stages, 1 to 3 years, 4 to 8, 10, 12, 13 years, we have different stages of growth. And we need that because during growth, the bones break down. They break down and they rebuild, they stretch and they get longer. They add in weight, in density, and in mass. So during growth, naturally, calcium is essential. Calcium is essential. It's 99% of the bone. So when bone breaks down, you need calcium to rebuild it back and then extend its height, its density, its weight. And so as you get older, you need calcium. As a woman, you need calcium, And then quickly, taking extra amounts of calcium has been said to help bones to rebuild and stay strong. So naturally, you could understand why you need calcium, food that contain calcium and also calcium supplements. So generally, uses of calcium. Calcium can be used to treat and prevent. Please note, treat and prevent low calcium levels. So you have low calcium levels in different health conditions, and once it presents, so the best thing is to have yourself on food containing calcium and calcium supplements. It also helps to treat and prevent muscle cramps. For those of us that have muscle cramps at the back of our feet, at different levels of our parts of our bodies, muscle cramps, remember you should be on calcium. And then osteoporosis, where you have conditions where you have weak bones, soft bones, bones that are brittle, osteoporosis. And then PMS, postmenopausal syndrome, and that's what affects we women from the ages of 40. We have early menopausal syndrome where it starts from like 35, 37. So we should take note of that. And then high blood pressure, cancer, all of this, calcium is indicated for use in these conditions where calcium can be used to prevent it. And then stroke. And then with vitamin D, it's been said that calcium levels are made to be high. So when you're on vitamin D alongside calcium, you have a greater chance of having calcium increased in its levels in your body. So quickly, other uses now will also caption some general uses. So quickly we'll run through. It controls high levels of magnesium, phosphorus. So you have some other elements. Calcium would also control its levels in the body. So when you have calcium in its right levels, you also have magnesium in its right levels. You have phosphorus and potassium in its right levels. So it helps maintain the levels of all of these other elements in your body. Then good evidence, it's also been said that it controls, high blood pressure too. It eases PMS. So it will ease a woman above 40 experiencing postmenopausal syndrome or postmenopausal symptoms. The symptoms that come with postmenopausal syndrome, where a woman is experiencing some sleep disturbances. At that period, she's not seeing her menstrual cycle anymore. She's experiencing sleep disturbances. There could be osteoporosis, because at that level there's gross reduced calcium level. She's restless, she's moody. The menopause women, what they experience, they're usually not they experience even low libido. They don't feel like making love to their husbands. They experience some things that don't have them feel like a woman anymore. So, but then calcium levels help every woman through that phase. Even before you get to that phase, you are kept safe through, even while going through it, on your calcium supplement or your calcium rich food. So it also plays a very huge role in prevention of cancers. Research has also proven all this. And then it also generally prevents women from postmenopausal or premenopausal women from experiencing breast cancer, because at the level where you have a menopause woman, she has reduced level of estrogen. There are a lot of hormones that have depleted, because her cycle is going backwards. Her menstrual cycle is going backwards. So it's like, what makes a woman isn't there anymore, and then she's predisposed to so many other illnesses. And we all know that there's some particular factors that predispose a woman to breast cancer, which is one there's a precursor to that. And so a woman is exposed to possibly having one during menopause. But then being on a calcium rich food or calcium supplement would help her through that. And then have been studied also to aid weight loss. So our women that desire weight loss, come in here right now. Weight loss, yeah, weight loss. So calcium rich foods and calcium supplements will help that weight loss program you're on. So quickly, which are the people that should most likely have or would most likely have low levels of calcium? One are postmenopausal women, are women that are going through menopause or about to go through menopause, and then the patients that are lactose intolerant. Patients that are lactose intolerant are people that are unable to absorb lactose from any lactose rich food, in like our dairy products, like our milk and all the proteinous food, where you should have calcium rich, that are calcium rich, but they are unable to digest milk, which is the major source, major dietary or dairy product that contains lactose. So the bowel of these patients are unable to break down lactose. They are unable to absorb lactose. So it gives them a lot of disturbances, and they avoid lactose. They avoid everything that has to do with dairy products that contain lactose. So they are most likely able or possible to have low levels of calcium. So dosages of calcium. How much calcium do you think we should need or we should take at different levels of growth? So quickly, the recommended standards for calcium levels are the dietary reference intake, the DRI, and the RDA, the recommended daily allowance. So these standards help us measure the accurate amount of calcium we should have in our food or in our supplements daily. So quickly, from 0 to 6 months, you shouldn't be having, you should have between 200 milligrams daily. 7 to 12 months, 260 milligrams daily. 1 to 3 years, 700 milligrams daily. 4 to 8 years, 1,000 milligrams daily. You can see that you are almost unable to have that on a daily basis. So definitely you should have your children on supplements that contain calcium. Then 4 to 8 years, 1,000 milligrams daily. 9 to 18 years, you should have up to 1,300 milligrams daily as your recommended daily allowance. And then 19 to 50 years, you have 1,000 milligrams daily. Now it has dropped in level from 1,300 to 1,000 milligrams daily, because between 19 to 50 years, there is reduced growth. So the demand of calcium in our bodies tend to reduce. So for then 70 years and above, you have 1,200 milligrams daily, because the need for calcium gets to increase. The muscles need calcium, the heart needs calcium at that level. So take note, there is no preference to high amounts of calcium with pregnant women and breastfeeding women. Just stay within your RDA levels that have been stated. So then upper intake. So there are tolerable amounts of upper intake we should. So back on, there are upper limits, to the intake of calcium. These are the limits that you shouldn't exceed while you're on calcium. So quickly, for 0 to 6 months old baby, they shouldn't be on calcium levels above 1,000 milligrams. That's about 1 gram. Then 7 to 12 months, they shouldn't be above 1,500 milligram calcium daily. Then children 1 to 8 years, 2,500 milligrams daily intake of calcium. They shouldn't exceed that daily. Then 9 to 18 years, those are our teenage years. They shouldn't have above 3,000 mg. That's about 3 grams daily. Then adults between 19 to 50 years shouldn't have above 2,500 milligram daily. Then adults over 51 years shouldn't have above 2,000 milligrams daily. So you can see you have an upper limit and a recommended daily allowance to guide us on our calcium intake, our calcium supplement use. And so you can't ever have an overdose of calcium. So, but then it's best taken with food. Take note, please. Calcium supplements is best taken with food, with lots of water, so it's eliminated easily, and it's best taken in portions, preferably 500 milligrams at a time for we between 19 to 50 years that could take with an upper limit of 2,500 milligrams and a lower limit of 1,000 milligrams. So we have a window dosage between 1,000 milligrams and 2,500 milligrams daily. So 1,000, 2,500, we have that window. So you're either taking not less than 1,000 milligram daily, then not more than 2,500 milligram daily for we between 19 to 50 years. So we have that to caution ourselves. Then we can now break it. If we're going to have 1,000 milligram daily, then we should break it 500 milligram maybe morning and then 500 milligram at night. Or if it's about 2,500, then we could break it into four times daily or 5 times daily use of calcium. Because in that portions, calcium can be absorbed wholly and completely without eliminating its excess, and it can be absorbed easily. But when it's taken in bulk form, it finds it's difficult to absorb, and of course excess amounts at a time will be eliminated. And then natural calcium sources, we have our milk, we have our cheese. These are our food that contain calcium: yogurt, broccoli, kale, Chinese cabbage, fortified cereals, juices, soy products. We already have our soy products. They are all food rich in calcium. And then there are some of us that are on some vegetable diets. I think you should watch your calcium level and be on calcium supplements if you don't have enough in your diet. Our vegetarians, our people on a diet, watching our diets, most times we try to avoid many dairy products because it contains some fat we don't need, but we should watch our calcium intake and level. Then those who can digest lactose, like I told you earlier, lactose intolerant patients, they should also be on calcium supplements. And for those who take a lot of protein, a lot of sodium, they tend to reduce, they tend to increase the level of calcium elimination taking place in the body. So the body loses a lot of calcium when when the body's made to take a lot of proteinous drinks or sodium drinks that contain sodium. So for those who also have osteoporosis, they are also should be in with the use of calcium supplements. And then for those of us that are on some corticosteroids, some of us that have some breathing issues, allergy issues, we're also always on corticosteroids. So for many of us that are on some corticosteroids for some autoimmune illnesses like some arthritis, rheumatoid arthritis and all, we should be on some calcium supplements. And then for many of us that have some bowel issues where we're unable to digest lactose out of dairy products like milk, we should be on calcium supplements. So this is just basically all that I have for calcium. And how do you know that I'm having some side effects out of calcium use? You feel bloated. That's one of the things you feel. You feel bloated. You feel gassy. Your stomach will feel the loss of gas. You feel constipated, basically. And it's one of the things most pharmaceutical companies use to treat some issues, some GIT issues. When you have some calcium in your product, it could help handle the opposite. Like if you're handling some indigestion that results in increased diarrhea and all. When you have calcium in those products, it tends to balance out the other elements and other the symptoms of the stomach. So then you can never have too high of calcium, because as I've stated, the upper limits and the lower limits, you can never have too high of some. So there can be a situation where you'd have an overdose. So I think we should just forget it and have our rich food, calcium rich foods constantly taken daily. And when we know we can't meet up, which we know we can't meet up, always have our calcium diet with the calcium supplement. And then our major calcium supplements is the calmazine, which I'll always introduce at the end. I'll have a picture attached to this video so you see what it looks like, and it's so affordable. The price will be attached to the video as well. Thank you.